Hello. So this video is the importance of pap smears. If you're not sure when you're due for your pap smear, you aren't alone. Pap smear guidelines have changed over the past few years, and keeping track of them can be confusing. You may not need to get tested as often as you used to, but pap smears are still a crucial preventive measure. Women should start getting pap smears at 21, and they should continue getting them every 3 years until they're 65. If a screening detects abnormalities, a patient may need to get tested more frequently. What is pap smear? Pap smear examines the cells of a woman's cervix to see if they are healthy. The test emerged from the studies of Dr. George Papinskilu in the 1930s. Pap test can detect the early signs of cervical cancer, the 5th most common cancer worldwide, and the 8th most common cancer in American women. Your chances of developing cervical cancer peak in your 30s and again in your 50s. The importance of screenings. Although new recommendations call for fewer pap smears across a woman's lifetime, Dr. Edmonds emphasizes the importance of receiving them. You're keeping up with your medical screening by getting a pap smear. He says, if a woman skips tests, she may be putting herself at risk. You could be missing something that could be potentially dangerous over a long period of time, but detrimental to your health. Shifts in screening guidelines. So why did screening guidelines change? Abnormalities in cervical cells take a while to evolve, and cancers may not develop for a decade or more. In fact, some abnormalities simply disappear on their own. We found that we were intervening and subsequently having women undergo unnecessary testing and procedures. If your pap smear results are normal, your chances of developing cancer in the following 3 years are very low. But precancerous cells may develop in time, which is why you should get another screening in 3 years. If you do have a pap smear that shows abnormalities, don't assume the worst. An abnormal pap smear doesn't mean cancer. The patient may need to follow up tests, which could lead to additional screenings or procedures. HPV and cervical cancer. An abnormal smear may be the result of human papillomavirus or HPV. This virus can cause cervical cancer in women, but it doesn't show any symptoms, so women should take steps to protect themselves in advance. The Gardasil vaccine can prevent some HPV strains. It can also guard against genital warts. Girls as young as 9 can receive the vaccine. HPV is extremely common, and approximately 8 in 10 women will become infected in their lifetimes. Dr. Edmonds recommends that patients receive the Gardasil vaccine and schedule regular pap smears if they're 21 or older. Pap test and annual well women exams. Even though women may need less frequent pap smears, they still need to visit their gynecologist for annual exams. A pap smear is not the same test as a pelvic exam, which can help doctors find abnormalities beyond just the cervix. Additionally, women can discuss birth control, hormone issues, and other important topics at their annual exams. Dr. Edmonds recommends that women want to protect themselves use condoms during sex, which reduce the spread of HPV and other sexually transmitted infections. Routine exams such as pap smears can greatly reduce your risk of dying from cervical cancer. So talk with your doctor about how often you need to be screened. For more information on pap test, you can talk to your gynecologist. So thank you for listening.